Here is your question. Right. So if you have read and understood, considering it communication skills technique, please begin.
Yes. Hello, I'm Dr. Faizan. I'm the SHO looking after my consultant. Uh, are you the mother of
Yes, I need to know what happened to my child.
Yes. Can you please have a seat? I'll explain it to you.
I need to know just now what happened to my child.
Yes, please have a seat. I will tell you everything. Please calm down and have a seat.
Also water, maybe.
Yes. Yes, I can offer you a glass of water. Please have a seat.
Okay, thank you.
Yes, I was told to speak to you about your child. Can you please tell me what you know about your child so far?
I don't know anything. I don't know my child is in danger.
Yeah. What else do you know? Well, I will be telling you everything. Before that, if you could please tell me what you know.
I feeling I'm losing control. I can't think anything right now. Can you tell me about my child? Where is he now?
Sure. Yes. Yeah, as you know, your child was brought to the from the school with complaint of severe abdominal pain, and on our examination and investigation, our diagnosis is, I think, our diagnosis is appendicitis, which is the appendix. It is an organ in your tummy on the lower right side, and it is a problem with this organ. So she was started on fluids and antibiotics, and she's now shifted to the OT, and we are waiting for our consultant to come and operate on her.
Are you sure that my daughter has acute appendicitis?
Yeah, based on our clinical examination and the lab test, the most likely diagnosis which we could think of is acute appendicitis, and so we have planned to operate on the patient. And I'm so sorry that you could not see.
Is it dangerous?
Yes, it could be dangerous. Yes, acute appendicitis in children can be dangerous, as these children they have less fat in the tummy, so if it ruptures, then it can cause a problem, and it can be life-threatening as well.
Will the one who will be disfiguring for my child?
Yeah, we are carrying out a surgery in which we will give incision, so there will be a small scar on the wound, and if we need to extend the incision, then that will leave a bigger scar, if at all we need to extend the incision.
Okay, if there any other problem could occur to my daughter?
Here, as we are suspecting acute appendicitis, and if there is any chance of rupture, then there could be a problem of the fertility of your child. If it ruptures, this can be due to the formation of bands. It's like once the appendix ruptures, there is a all formation of bands with the surrounding structures. We call these adhesions. And if these are formed with your the reproductive tubes, then this may affect the fertility of the child. But just mentioning these, this doesn't mean that it is bound to happen, but there is a chance.
Do you mean that she can get pregnant in the future?
There is a possibility, but this is too early to comment upon. We will have to see intraoperatively the condition, and if at all this problem arises, then it can be dealt at a later stage when she grows up.
But Mr. Man did the operation for my husband and he died.
Can I know, please, what condition your husband was suffering from? I'm so sorry to hear that your husband passed away. But can you please tell me what condition he was suffering from?
My husband has a cancer. Had a colon cancer, and he has operation, and he's died on Mr. Lad hands.
So, Mrs. X, the condition here which your child is having is very different from the condition your husband was suffering from, and I can assure you that your daughter is in safe hands, and Mr. Ladd is experienced for a surgeon who carries out such operations regularly, and hopefully everything will be all right.
Okay, can I see my daughter right now?
I'm sorry, but you cannot see your daughter right now, as she has been shifted inside the operation theater, and we are preparing her for the surgery, and she will be. We won't have access to the operation theater right now, so unfortunately, you can't see her right now.
How is shifted to the operation without any consent?
Yeah, here, as it was an emergency, we had to shift her to the operation theater, and now I will be taking your consent right now for the surgery, as we could not wait for you to come, as it was an emergency, so we had to shift her early.
So you are waiting the consultant, or you're doing the surgery? I don't know. I feel panic right now.
See, your child is in the operation theater right now, and probably she's being given anesthesia. And Mr. Man, our consultant, is on the way, and he will be arriving in a short time, and he will be operating on your child.
So the consultant didn't see my baby before the operation?
Yeah, the consultant hasn't seen, but your daughter was seen by surgical registrars and a good team of surgical doctors, and we have come to the conclusion that she has appendicitis based on the clinical findings and lab investigations, and that she needs surgery. Hence, she was shifted to the operation theater after consulting the surgeon over call.
Okay, thank you.
Last question. Are you sure it's the condition that you are telling me it is?
We cannot be 100% sure that it is appendicitis unless we open up and see inside the abdomen. But based on the clinical findings and lab tests, it seems that it is appendicitis.
What would be the layman word for clinical examination and lab test? Maybe you can say blood test that we have done and the checkup or examination that we have done.
Okay.
Okay. 20 seconds left. So what more question can we ask? So you can ask the mother. If you agree, then kindly please sign on the consent form.
Yes. Yes. If you agree, please sign on this consent form so that we can proceed with the surgery.
Okay, I will sign.
Thank you.
Good. Thank you. Thank you, both of you.